That is a great question.
I just got the note. Yeah, just heard it. Good to go.
Okay, good.
Um, so, yeah, so I think for today, I'll just kind of run through a quick agenda. So for this session, I'll start, with just a quick background on PolicyMap and the Interact for Health enterprise site. Since I know that there have been sort of like some newer partners who have recently got access to the site. It can just sort of start with a little bit of that, background and context. For the actual demo, we will focus primarily on some of the basic functionality, site navigation, and support resources, how to make maps, how to interact with data layers and data points. And then kind of once you've made a map, sort of like what you can do with it, printing it and exporting, saving, sharing, accessing the underlying data. So that's kind of really kind of what we'll focus on primarily in terms of the functionality that we'll be talking about during this session. Um, as Colleen mentioned, if you have any questions, you can drop them into the chat in Zoom. I usually save like the last 10, 15 minutes at the end for like a Q&A session if you need to kind of go deeper on anything. So for those who are not familiar with PolicyMap, this is kind of just the quick background. So we're an online mapping and data platform. We are based in Philadelphia. We're a small business benefit corporation, and basically we combine roughly a combination of public data sources and from a lot of federal agencies, so housing data from HUD, a lot of demographic data from the census, health data from CDC and HRSA, as well as some proprietary data that we license on things like home sale activity, school performance, and other things like that. We put them all together into an easy-to-use mapping and reporting tool. The data is cross-sector, so you'll see that as we get into the demo, and I'll highlight some examples of sort of relevant data on one of the next slides. Um, some of the uses of PolicyMap are there, a lot of, research, um, site selection, grant application, impact analysis, overall just data visualization. We work with federal, state, and local government agencies. Lots of universities use PolicyMap for research purposes as well as in kind of like coursework. Lots of nonprofit organizations and also public health agencies and organizations that are kind of interested in um, addressing, social determinants of health, issues related to health equity and things along those lines. We started as part of an organization called the Reinvestment Fund, which is it's a community development financial institution. They basically kind of do a lot of work, kind of putting financial resources into distressed communities, and that was sort of how we started originally as like an internal tool, and then kind of spun off from there. So the Interact for Health Policy Map site, it's what we refer to as an enterprise license. It basically, it just includes all the data and functionality that's available sort of in the full Policy Map platform. And the tool is available to Interact for Health grantees and partners. It does have a unique URL, so it's interactforhealth.policymap.com. And when we get into the demo, I'll show you what the landing page looks like when you put that into your browser, and it's accessible from any internet connection. So it's fully web-based. And the tool is focused on the Interact for Health region, so the greater Cincinnati region. Some examples of data that's available in PolicyMap. So there's lots of data. We won't be able to kind of preview everything during this, demo, but just some highlights of, available data that may be particularly relevant. So lots of demographic data, as I mentioned, on, population by age, race and ethnicity, language, households and families. We have data related to food access and lots of housing data on, subsidized housing, housing cost burdens, housing tenure, number of, renters versus homeowners, those kinds of indicators. Um, Health data on chronic conditions, different underlying kind of health risk factors, social vulnerability index, area deprivation index, um, income and poverty, and then certain quality of life indicators on things like transportation access, computer and internet access, risks related to natural disasters and those kinds of things as well. Just to kind of touch on this briefly, so with the incoming administration, certain federal data sets have gone offline in the last 6 weeks or so. So a couple of examples are like the Climate and Economic Justice Screening Tool, the Social Vulnerability Index, CDC Places. Some of them have come back online, others have not. And then just in terms of kind of with some of the reductions in staff and departments within some of the different federal agencies. There is, some uncertainty about the availability of other federal data sources kind of moving forward. So I'm just sharing here a link to a post that we put up in February. It's definitely something that we're paying attention to, and we are sharing updates in our newsletter about this topic. And ultimately, it's just kind of we want to mention it because, if there are certain federal data sources that, when you're looking other places, you're not able to find them, we'll still have them available in PolicyMap, and we'll highlight some of those during the demo today. And then kind of leaving this here, I will show some of these support resources and kind of where they're available. But just for kind of posterity's sake, we have a support page that has lots of guides and tutorials for just like basic support and technical questions. We have a support email, support@policymap.com. We do have a phone number too, if you kind of want like some live kind of help desk support. Um, so, and then in addition to the PolicyMap resources, Interact for Health has also developed some resources specifically for, partners that are using the Interact for Health instance. I'll show where those are, but they're kind of like some targeted sort of specific use case videos using the actual like Interact for Health tool. So, and those are available on the Interact for Health website. Um, so I'll transition now to the demo of PolicyMap. So I'll pull up the Interact for Health site, make sure I have my chat window opened. Um, so this is what the landing page looks like. So if you go to interactforhealth.policymap.com, this is the screen that you should see. Um, Colleen is the administrator. So for, logging questions or for, requesting access to the site, Colleen would be your contact for that. So I'll just log in so we can get started. Close these notifications that do appear up in the top right, just when there's data updates or new data additions. And so when you log into the site, it will kind of be centered around the greater Cincinnati region. So a few site navigation items to start out with. So up in the top right-hand corner, you'll see a link to our help docs. So if you click on that, this is our support page. So this is where you can find different guides on different functionality if you're looking to um, use custom regions. You can click on here, kind of drill down into more specific things. These are also searchable. So if you're, looking at how to download data, you can do data search directly within there, see a posting, and then kind of learn about downloading data out of PolicyMap. Um, Within here, we also do have a video gallery of just sort of some really brief videos going through key functionality. And then in addition, there's a what's new section where we just post sort of a running list of new and updated data as it's being added to PolicyMap, as well as new and updated features. So we always like to just kind of point that out so that folks are aware about that. So then in addition, on the Interact for Health site, you can find some of those resources specific to kind of using PolicyMap in the Interact for Health enterprise site in the data mapping tool. And there's a little kind of embeddable map on here, which is just sort of like a simple kind of more intended more for kind of like a general sort of public audience. But if you click on the button right below it, the resources for PolicyMap users, this is where you can find those use case videos that I was talking about that kind of go through specific functionality and features within the Interact for Health site and kind of like in sort of more like tailored relevant use cases. So that's the support resources. Up in the top right corner, we also do have a data dictionary. So this is um, where you can see the data sources and kind of details on all the data sources that are part of the PolicyMap data library. So it is just kind of a really long list. We also have them kind of listed here on the right-hand side if you wanted to click through to a specific one. But there's lots of documentation in here. There's also when you have like a data layer or a data point on the map, you'll also, I'll point this out, but there will also be links to the data dictionary entry for the specific source that that data is coming from. So, but that's where you can access the full data dictionaries up there in the top right-hand corner. So, one of the sort of, when you're in the tool, you can pan around, but just clicking down, the using the left click on your mouse, you can zoom in and out using your scroll wheel. So to, just if you've used any kind of like online mapping tool like Google Maps or anything like that, that should feel pretty familiar. One of the key pieces of functionality in PolicyMap is this location search, which is just above the map window. So in here, you can search for a specific address, or you can search like a city, a county, or a zip code. So I'll do a zip code within the region, click on that one. It'll zoom to zip code 41075, show me the boundary for that zip code area. We'll come back to some of these buttons once we have some data on the map. If you zoom in closer, you'll start to see like additional detail populated on the base map, start to see like some of the building footprints and those kinds of things. You can toggle different base map options using this gear icon in the bottom right-hand corner. So from here, you can choose like to use a different base map style. We do have a satellite imagery base map. We also have like a terrain and kind of more of like a light kind of gray base map option. So this is kind of really just in terms of kind of customizing the look and feel of the maps that you're creating. And then within each of those, you can turn on and off different features of the base map. Like if you don't want to have like the roads displayed because it's too busy on the map, you can just uncheck one of those boxes or turn off road labels or like some of the place names, those kinds of things you can turn on and off. So different base map options are going to be available for each of those styles. So all of the data that's available from the PolicyMap data library is going to be organized into these data menus across the top of the map. So from demographics, kind of all the way down through federal guidelines and the curated collections. Um, this is all, PolicyMap data. It's organized by theme rather than by source to try and make it, easy to find what you're looking for. And so if you click on one of these, you'll see that there's different indicator groupings that, um, go into more, specific indicators. You look at population by race, ethnicity, race, and it gets, can get very, specific depending on the specific set of indicators that you're looking at. So they kind of cascade out that way. Um, so I'll show just a couple of the key federal data sources that have not been sort of consistently available over the course of the last couple of months. So under the quality of life, environment, and disaster risk, this is where we have the CDC Social Vulnerability Index. So you can kind of navigate through the menu, find the Social Vulnerability Index, and then if I click on one of those indicators, it will then load that onto the map. And so in this case, this is showing the SVI ranking displayed at the census tract level. And that's kind of what we're seeing on the map right now. The couple of other ones that are in there kind of they all, some of the data, sources that were offline tend to be, in sort of a similar category. So, the climate and economic justice screening tool data is in here, as well as the CDC Environmental Justice Index, kind of another one of those ones, FEMA's National Risk Index. Some of these ones kind of related to kind of risks of natural disasters or some of the kind of environmental justice related indicators. So there's some in here. The climate and economic justice screening tool is also kind of cross-listed under the federal guidelines. So this is kind of where that one is. And that one was kind of specific to some of the Inflation Reduction Act kind of funding and identifying these low-income kind of historically disadvantaged communities in terms of like environmental justice or exposure to pollutants and those kinds of things. Um, so anyways, um, there's those data menus. That's kind of how you can navigate through, kind of find data that you're looking for. In addition, within the Interact for Health site, there's also a social drivers of health tab, and this basically has some of the same, the same indicators that are available across all these PolicyMap data menus, but organized into um, more of like an SDOH kind of framework. So if you're kind of looking at like, food access or food and nutrition related indicators, or you're, looking at something, indicators related to the built environment, you can kind of find them in this social drivers of health in, tab organized into that type of framework if you're working on those types of issues, which I know is kind of relevant to a lot of the Interact for Health users. So the last way just to kind of find data, there's lots of ways to try and find data because there's lots of data in here, but the last way that you can search for data is actually using this data search. So just to the left of the location search is where you can search by keyword to find a data layer or a data point that's available in these data menus. So if I were to search on depression, you can see some of the results. CDC, a couple of the CDC places indicators, indicator from CMS. And when you click on one of these results, it will load that on the map. So now it's kind of switched to showing us the crude percent of adults with frequent mental distress from the places data. So we'll build on this and kind of go forward, and we'll kind of compile a map here, and going to look at a map showing this indicator of adults experiencing frequent mental distress, and then also we'll layer on locations of mental health treatment facilities. So anytime you have a data layer on the map, over in the legend, you'll see the label for the data layer that you're looking at. If you click on this little eye bubble. This will bring up a little bit more of a detailed description about that indicator. You can see there's a link to the data dictionary for the source here. You can also click on the hyperlink just in this source listing, and it will redirect to the actual, source within the data dictionary where that indicator is coming from. So this comes from places data, and then in the data dictionary entry, you'll see, it shows like the years that are available, the last update on PolicyMap for more information. So kind of like links directly to those sources. And then there's like descriptions about how we work with the data that are down here. Sometimes there's like more details depending on the specific data release. So lots of documentation captured there in the data dictionary. Within the legend, there's going to be different options to change what you're looking at on the map. So if we wanted to keep this same indicator, but look at a different time period, you can use this year dropdown to go back to 2020 as the year of the data. And then it will show you, that same indicator for 2020. You can also look at different variables by clicking on the variable dropdown. There's different color options that are available. So if you want to change it from sort of the default purple color ramp, you can choose a different color ramp option. You can also create your own custom color scheme, um, clicking on this link, and then you just kind of choose from the different color options down here, build out your own color scheme, color ramp, and then you can save that to your account. So it's kind of associated with your login, and then you'll be able to use that when you're compiling your maps. You can also change the ranges, which is, the specific cut points at which the data is shaded on the map. So, obviously the darker areas are where there's like a higher percentage of adults with frequent mental distress. The lighter areas are where that's a lower value. But you can change these cut points using this range menu, change the number of ranges, and then you can actually use these sliders or edit these numbers directly. So if you wanted to, make the top range just where this is greater than 22%, you can slide that over. You can move the middle ranges. So it's kind of nice. You have this histogram here, which is sort of shows you the distribution of the values. So you can kind of make some educated decisions about kind of how to change your cut points and your ranges. And if you want to restore, back to the defaults, you can always click on that button at the bottom and restore the default values. You can also click on the ranges within the legend itself over here if you wanted to kind of like just highlight those that are in the top two kind of highest ranges in terms of percent with frequent mental distress. You could click on those two. It kind of hides everything else that's going on around it. So you kind of just focus on those census tract areas with the highest frequent mental distress. You can remove those by clicking on the X's in the legends. And then the last sort of drop down or kind of option within the data layer legend is you can choose, there's this shaded by drop down, which shows you, what the data layer is currently shaded, what boundary the data layer is currently shaded at on the map. So this is typically going to be defined by like how close you're zoomed on the map or how far out you're zoomed. So if you could like zoom further out, eventually this will switch to zip code areas. And then if you were to continue zooming further out, it would eventually switch to like counties. Um, but if you wanted to specifically set a boundary to keep the data layer shaded at regardless of kind of how close you're zoomed or how far out you're zoomed, you can also choose a specific one within here and you can use this little lock icon just to keep it locked to that specific shading so it just stays there regardless of your zoom level. So if you were to, so you may notice like as you're moving your mouse around, you'll see a little hover which shows you, based on the census tract that I'm hovering over right now, the estimated percent of adults who have experienced frequent mental distress is roughly 24% in this census tract area. That changes depending on, where your mouse is placed. If I click on the specific tract, you'll see a little trend chart where you can see a little change over time. You can expand this by either clicking directly on the trend chart here, or you can use this trends button to see these kind of hierarchical, kind of contextual boundaries, which can be nice for kind of doing sort of comparisons of like a smaller area to the city, the county, that kind of thing. So you can see, how this census tract compares to Hamilton County and then, the national values. Each of those also has a little trend chart, and you can expand these trend charts by clicking on the button up there in the top of this little sidebar and add those contextual boundaries um, to your trend chart. And this is just one way to create like sort of a different visualization, besides the map, but just to create like a quick trend chart. And these are interactive when you're in here, but you can also just export these as an image if you just want to pull that out real quickly. So it's kind of, some of the core functionality in terms of interacting with data layers. So we'll put a data point on and show a little bit about that. And I'm just going to do a search for mental health treatment and see this is a data point. So we'll put that one on the map. So, the data layers are going to be sort of these more like thematic, shading by census tract or zip code or county, some sort of variable. The data points are going to be the actual like point locations of a mental health treatment facility, a school, a hospital. Um, and so they'll show up as these little kind of pin icons. You can change, especially with this map, the coloring is a little tough right now. So you can change the icon shape, size, and color from the point legend. So if you wanted these to stand out a little bit more, maybe we'll make them like orange circles. And so with these mental health treatment facilities, if you hover over one of them, you can see, a label for it. And then if you click on a specific point, you'll see the attributes in these collapsible menus. So you can see additional site info. And in this case, there's kind of lots of information and additional attributes on the different treatment and age groups they serve and special programs that they offer. And so all of these attributes really kind of vary depending on the specific point data that you're looking at. Over in the point legend, you can also turn on and off labels for those points. So if you wanted to turn on the labels for the treatment facility points, you can turn those on, turn them off. Um, You'll also see there's a link here to the data dictionary for this one, which comes from the Substance Abuse and Mental Health Services Administration. And then within points, you can also filter if you want to see like a subset of the points based on a specific filter option. So if you wanted to look at, those that offer language services in Spanish, you can choose that filter option. Then the kind of points remaining on the map are just those that kind of meet that filter criteria. And you can remove a filter selection by just clicking on the little X in the point legend. So we have our data layer on the map. We have our data points. Um, So some other things that you can add just to kind of complete your map, you can add boundaries as an overlay to be able to kind of better distinguish like the census tract boundaries, or if you wanted to layer on like zip code areas as a boundary on top of this. So there's a boundaries menu in the top left, just to the left of the social drivers of health. And there's different boundaries in here, like standard sort of jurisdictional boundaries like counties and cities, as well as like zip code areas, congressional districts, legislative districts. Um, but in this case, like if I just wanted to be able to better sort of see where one census tract starts and ends, I can put on the census tracts as a boundary. So I now have sort of those black outlines of my census tract boundaries. You can turn off the labels for those because it's a little busy by clicking on the little label icon in the boundaries legend. But you can also change sort of like some of the styling of your boundary outlines if you wanted to use like dashed lines or dotted lines as your boundary outline. You can change the line weight. You can also change the color on these if you're kind of depending on the type of visualization you're creating. If you wanted to change those as a different color, you can also do that. And you can move these around as well if it starts to kind of fill up on your screen. So I'm going to do a couple more things just to kind of further customize this map for a selected location. So I'm going to look at specifically Butler County. So search within my location search for Butler, Ohio. And going to actually kind of come back to some of these buttons that we didn't talk about earlier. Um, so so this will show us the boundary for Butler County. So some of these buttons and kind of what they talk about what they do. So you can use this scissor icon to clip based on that boundary that you just selected. So if I wanted to, just see the data within Butler County, I can click on that clip icon. And so now everything kind of outside of Butler County is sort of masked. You can also apply like a white background if you really just want to focus on the areas within Butler County. So down here, you'll see, the same clip icon, and you can toggle it on and off here. But then there's this checkbox if you wanted to like kind of white out everything else, outside of your selected location. Um, We didn't talk about this earlier, but you can also in the data layer legend choose to kind of have your data layer um, contextualized to just the areas within your current map extent rather than kind of considering like the full US data, which can be helpful for, drilling down within a specific kind of jurisdiction on a data layer. So it's just this little toggle where you can switch from US data to just the map extent data. And then it kind of just resets your breaks based on, just those like census tracts that fall within Butler County in this case. So then you can kind of really see like the areas that, within Butler County, the census tracts that kind of stand out the most in terms of frequent mental distress. Um, so, we've created our map here. We have our data layer, data points, showed a little bit about um, clipping and using the map extent view. So the let me just say, I'll just round it out by talking about these other kind of buttons within the Butler County or kind of within this selected location. So, and then we'll talk about kind of printing and sharing maps. But so the other kind of buttons in here that are available. So we talked about the trends. You can also use this table button to open up that sidebar again over on the right hand side and kind of view the data that falls within that selected location. So this would be like you want to see all the census tracts in Butler County and see what the estimated percent of adults experiencing frequent mental distress is for all those census tracts. So it'll give you that list, show you those 86 census tracts within the county and the estimated percent for that indicator. You can sort this too based on the values. If you like wanted to see the census tracts, with the highest values, it'll show you that list there based on that sorting order. And then you can also click on the download here, or similarly, just on this sidebar, click on this download button. And this would be if you wanted to download the underlying data out of PolicyMap. So if you want to download the data layer, like the census tracts within Butler County with that indicator or the point data, you can also download the mental health treatment facilities. Um, and then you can choose whether you want that to go to your email or just download directly through your browser. And you can change the file name if you want. Just click on the download data button and it will generate. Um, in this case, it'll go to my email based on what I selected. If you do it through your browser, you'll see like a little pop-up notification up here in the top right. And this is kind of this little folder icon in the top right is where like anything that you've downloaded or maps you've exported, that's kind of where those things will show and where you can access them. Okay, so for um, what you can do with your map now that you've produced it, in the bottom right-hand corner is where you'll see some of the different options. So you can print this or export it. It's kind of the same thing. So if I click on that print button, it'll generate a little print preview. You can move this around and zoom in and out to kind of get this lined up correctly. You can drag the different legends around and get this all kind of centered up. And then there's some different options over here in the print preview, change your file name, the layout, print margins, if you want a PDF or an image. You can decide to turn on and off different legend options, scale the text size, add the data layer description if you want. And you click on this little pencil icon to edit the actual like title of the map. Just defaults to pulling in like the data layer just label, but you can change that as well. And then once you choose, to made any kind of selected any different options, you click on this export button, and then this will tells you that that notification will appear up in the top right once that's exported. So that's kind of how you can export a map out. You can also save any maps that you've created by clicking on the save icon. You can, put in a title for your map. Save that, and then if in the future, so it'll save everything, where you're zoomed to, if you have something clipped, data layers, data points, and then you can come back to it in a future session when you go to this saved work icon. So that button right below it, you'll see this in the map, the saved maps, and click on that link, and it'll just kind of bring you right back to that view. And this is the saved work is where kind of like any other sort of things that you've created custom regions that you might make, or if you save a data set that you uploaded or any of those kinds of things, they'll all be kind of captured in your saved work. So then the other option is sharing maps that you've created. So just below the saved work is the share button. So you can, share this with other users of the Interact for Health site. Click on that, create the link, copy that, share it with another, user, and then they can open this up, and again, they'd come to the exact same kind of view that you've created with your map. You can also, have send an email directly, from PolicyMap. Um, and then depending on the data that you have, some data, where it's just sort of set with sort of like fully sort of public data permissions, you can also, create embeddable maps, as well as like share just interactive map links, even with like non-Interact for Health site license users. So, and then, we already talked about the, downloading of data and that kind of thing as well. So, um, I think that really I think is the captures a lot of the basic sort of core functionality of using the Interact for Health enterprise site and just sort of, policy map. Happy to kind of transition to the Q&A session if anybody does have questions. I didn't see anything pop up in the Q&A or in the questions, sorry, the Zoom chat. I didn't see anything pop up during the session, but if anybody has anything, feel free to drop it into the Zoom chat. I don't think there's a ton of people, kind of a huge group also. So if you're wanting to kind of just unmute and ask your question live, we can also just do it that way too.
Brian, I have a question. If you upload your own data that you want to share with other people at your organization or whatever, just if you upload your own data, is that available to, first of all, can you share your own data? And
Mhm.
second, is that available to anyone using the Interact for Health enterprise, or could you um, like limit it to just people within your organization?
Yeah, no, it's a good question. So we do have a data uploader, and that's going to be up in here in the top right-hand corners where you can access the data loader. And so the data loader is for like if you have um, a spreadsheet of addresses, of something like um, health centers or something along those lines, or sort of like community partners, or like anything that sort of like has an address associated with it that you might want to upload into PolicyMap to be able to see as points. Um, that's what you can use this data loader for. And so on the data loader, there's kind of different steps that take you through loading the data. Once you have your, list of addresses and any other sort of like attributes of it, um, you can save it as a CSV, bring it into PolicyMap. But there's these viewing permissions here that you can set where you can either choose to have it available just to yourself, um, or you can have select individuals and you can put in email addresses and then add other email addresses. Um, and that would be the option you would want to use if you just wanted to share it with like specific users of, that have access to the Interact for Health site. The other option is this all enterprise license users, which is if you kind of are like just want it to be, it's just sort of generally could be of interest, I guess, to like other users of the Interact for Health site. And then um, that's that option. And then it basically, yeah, like it would just be visible as a data, as a uploaded point data set to all enterprise license users. This option, really regardless, so when you load data through the data loader, um, you'll see those uploaded data sets when you click on this tab to access and edit data sets. This is kind of where you'll see like any data that you've uploaded, and you can make edits to it after the fact if you want. Um, you'll also see data that's been uploaded by you or other users. Under this social drivers of health tab, this far right-hand column is where um, you'll see that data, and you can see like the ones that you uploaded. You can edit them by clicking on that pencil there. But then there's even here, there's like a few data sets that have been uploaded by other users and then kind of just shared with all users of the enterprise site. So tobacco retailers, kind of interesting. So that's um, kind of where you'll see any of those data sets that are up that you've uploaded through the data loader or that have been shared by other users. So, but yeah, um, that's where you would set, it's on that first sort of step when you're adding a new data set where you can select specific individuals, yourself or all site license users. And you can always edit that after the fact too. Um, if I go into this data set that I had previously uploaded, I can change the viewing permissions as well.
Awesome. Thanks, Brian.
Sure. So there was a question in the chat from Brian, not me, another Brian, Brian Kegley. Can the policy map citation be dropped in the map export? So within the map export, it doesn't have, it'll mention the source for the data layer and the data points. So you'll see it listed there, but it's not a full citation. Um, The full citation can be generated though. Just there's a little citing button in the bottom right, kind of below the share. And here's where you can generate like a full citation in different styles. Um, so those are the different citation options that are available. You can just copy it and then like drop it into a presentation or a document or report or anything along those lines. Um, so that's kind of, they are separated, I guess, because technically, probably because for some of these different styles, they can be pretty lengthy citations, but yeah, just within the print, it's really just like the data sources that are specified for the points in the layer.
Cool. Thank you. I was looking for a shortcut.
And then Rebecca had two questions on data upload. Can we upload a spreadsheet of lat long coordinates? And yeah, you can. Um, if you already have like latitude and longitude within the data loader, you can just basically identify like those as the lat long fields, and then you just kind of skip the whole like running it through the built-in geocoder. So yeah, lat long also works well. And yeah, and then the second part of the question, can we share with users on a specific domain, like all my coworkers at springdale.org, or do I need to add each coworker's email? Unfortunately, it is like individual user emails rather than email domain at this point. And then next question was from Sam. Say you want to download the data set for analysis other than mapping for a particular county. Um, and can you do that? So you can download data from PolicyMap for other like areas as well. Ultimately, you do have to select some sort of like location of interest, like bounding geography that you want to pull the data out for. We used Butler County when we were looking at that data download. Um, because that was sort of like the location that we had set in the location in the select location bar. But if we wanted to just download like this same indicator, you know, all the census tracts in Ohio, you can set like Ohio as your area here. Um, the other way that you can download data. So we were kind of showing like this little sidebar download in the demo. We do have another way to download data directly, which is this in the top right. So just to the left of the data, just to the right of the data loader is the data download. And in here, it'll pull over like the data layer that's on the map and the data points that are on the map. But um, you can also change this and search for a different data layer if you want. And this second part is where you do have to put in some sort of location. So you could put in like, I want all the census tracts in Ohio, or you can put in the United States too. You want all the United States. It'll be kind of the full data set. Um, so, but yeah, it's not limited to just like a specific county. You can do data downloads for larger areas as well. So Rita had a few questions. What are your data security measures for the uploaded data? If you only share it with a few select people, how safe is it? Yeah, I mean, the data, in terms of data security, I mean, the data is all hosted in AWS when you load it through the data loader. So it's fully encrypted in terms of like where it's stored on the AWS server. Um, in terms of, like sharing it with select users, like it's not, as long as you're only sharing it with select individual users, it's not going to be viewable by other users of the Interact for Health site. Um, and then the second part of the question, can you geocode how complete must the addresses be? So within the data loader, the addresses, you need to include the street, um, city, state, and zip, ideally. Um, so that's going to get you the most matches when you run it through that geocoder. We've been talking a lot. I can do a quick run through it because I think I have like a sample data set just because we have been talking about the data loader. Um, I'll just show quickly kind of what the steps look like. So this is like a sample data set that I used at some point in the past. Um,
I was just gonna say real quick too, Brian, while you're getting that set up, there's like a 2 to 5 minute video on our website specifically on data loading, like how to use the data loader. So you could also go watch that at some point if you have additional questions.
yep, that was one of those use case videos, is this data loader tool. Um, so yeah, this is, a very basic data set. Doesn't have a lot of attributes. You can have more within your data set if you wanted to have, like other information on whatever you're uploading. Um, you can have like up to 40 columns in the data. You can have up to 10,000 rows of addresses within the data. This is a pretty small one, but this is just sort of an example: street address, city, state, and zip code. This is like ideally what you would have to be able to complete it. Really, the street address and zip code are probably the most important. Um, so I have that CSV, and I'll just quickly show these steps. Create a new data set, and I'll should be able to drag this over. There's some tips here for setting up your spreadsheet as well. And you can give it a title or name, set the viewing permissions, and then choose like a point icon shape, size, and color. So on this next step is where you kind of tell the built-in geocoder, like, here's my address field, my zip code field, my state field. It will look at the column names, and if they're kind of already named in a way, using like a very typical address field name, it'll just identify them. If you have, going back to one of the previous questions, if you have like lat longs in your data already, you can identify those lat long fields by just clicking this drop down and saying like, use these lat longs. And then the next step is to geocode it. So it'll geocode the spreadsheet. And then here's where it'll show you the results. So in this case, 387 of the 412 points geocoded successfully. And then you can sort your results to see on this geocoded column. You can do a sort to show any of the addresses that were not geocoded successfully. And then you can make edits to a specific record by clicking on the pencil, and like you can complete this street address. Um, you can you kind of go through and make any kind of edits that you need to. And then once you've done that, it will try and automatically re-geocode it. Once you've made any sort of changes you want to make on any of those data loader or any of those rows, then you just click on save and continue. And then there's kind of just like should show us a preview. This is sort of a feature that was added more recently, so you can set up filters on your own data loader data set. So if you had like those tobacco retail locations in your data, and maybe you had something about like an attribute in that about, you know, the hours of operation or something like that. Not really thinking of a good attribute, but something that would make sense to have a filter on. Then you can add filter fields and set up your own filters. This data set that I'm using is pretty bare bones, doesn't really have any kind of columns that make sense to be set up as filters, but that's what this step is. And then if I just kind of continue through this, it will again show me the preview, and then I can make any last sort of edits I want on viewing permissions or the icon shape, size, and color. And then I'll view this on the map. I'll turn off my mental health treatment facilities for a moment. And so then this is the data loader data that I've uploaded that I'm now showing on the map. And then again, you can access it under the social drivers of health tab. There's the one that we just uploaded. I can edit it by clicking on that pencil icon, and then you'll also see it under that list of data sets um, that I have uploaded under my account on the data loader. So yeah, so that's just a very quick kind of run through on it. But um, yeah, best practice is, street address, city, state, and zip code. But having the street address and the zip code are probably the two most important. I know we have 2 more minutes. Anybody has any other questions? Happy to address those. And Colleen has shared the feedback form link into the chat as well. So definitely make sure to complete that to provide any feedback.
If we don't have any more questions, I think we can wrap it up. Thank you all so much for being here. Thank you, Brian. We really, really, really appreciate it. It's been super helpful. I learn new things every single time. I use PolicyMap all the time, and I'm always like remembering something that I forgot or learning something new. So really, really appreciate it. Yeah,
For
thank you all.
sure. Yeah, thank you. Good to be with you guys.
See you all later. Enjoy your Friday.